Hi, this is Dr. Lennox. I'd like to talk to you about blood testing and laboratory testing. First of all, I want you to know I got an attitude about this stuff, so you're going to have to hear it right now. I think there's way too much testing done, spend way too many dollars doing it, and not enough treatment. I sometimes have patients come in that have had $7 or $8 or $9 or $10 or $1,100 of tests done and not a minute of treatment yet. And I'm not so happy about that. So I'm very judicious about how I use lab tests and how I spend your money doing it. One of the things I've made the effort to do is to associate with a co-op where we get a tremendous discount on blood testing and I pass that savings on to you. That, I think, makes me feel a little bit better. Second of all, what I need you to know is that blood testing is a way of getting information about what's going on inside your body. However, it is information that's relative to other kinds of standards that other people have. So norms are comparative values that a lot of people are compared to. And the question's always going to be, are you at one end of the normal or the other end of the normal? Is it right for you? Is it not right for you? So if you go to your physician, regular medical doctor, to get lab tests, their responsibility basically is to make sure that you do not have a disease process going on and to medicate you appropriately if they find that you do have a disease process going on and to give you the advice for that. My purpose is distinctly different than that. The reason I want to see a lab test certainly is to find out that you don't have disease processes going on, but I want to know what container we're living in. I want to know the world that we're in relative to your health. And I can find out a lot of information about that. So there are different kinds of lab tests that we do. The most common one we do is a fairly complete blood panel that includes the cholesterols and the liver enzymes and the kidneys and the minerals, as well as a thyroid panel, as well as vitamin D, and the white blood cells and the red blood cells, and it's a very complete panel. And we get a very nice discount on that, and I won't bother you with numbers, that's more detail. Now, once we've ruled out the pathologies, which most of you have already dealt with somewhere else, and most of you don't need me to screen for that, although I can do that, what I'm most interested in is what are the relationships between the values that we see. I can see lab tests where they're essentially normal, but the values and the comparative values show me information about your physiology that we would not otherwise have. I've studied blood analysis, blood testing analysis, laboratory results with people who've done thousands and thousands and thousands and thousands of blood tests, and I've taken workshops with them. I've studied with them for years and years and years. And what we get from that is the ability to look at patterns in your blood test and understand how your physiology is shifting. One of the things that we see very clearly is in just the displays of the proteins in your body. We can tell when you're not digesting your proteins properly by numbers of different indicators. We can tell when your body has difficulty digesting carbohydrates. We can tell when your body's toxic. There are lots of things we can tell that show within the context of a perfectly normal blood test. And that's why we like to do that, because the more information we get, the better we're able to serve you. Now, the other thing we have to understand is that when I look at your blood test, that is not something that exists apart from you. That goes together with the other kind of diagnostic stuff we do. That goes together with interviewing you, understanding your diet, understanding your historical values, what's your genetic background, what kind of things exist in your family. All those things come together to form information. Because classically, if you approach therapy by blood test numbers, you're going to miss it. And that's the kind of idiocy that's out there in the world of trying to manage cholesterol numbers. We have people who are taking extremely toxic drugs so they show a blood value that everyone thinks is ideal. And that's never going to work out, and I'm certainly going to spend a lot more time at some other video discussing that one. But at any rate, that's the thing on blood testing. The other kinds of testing we can do are adrenal hormone testing, other kinds of hormone testing. That we use saliva, we use urine tests. And again, what I want you to understand is that I have studied those from the point of view of how to normalize physiology, how to optimize physiology for you, not just hit numbers. And we do that with nutrition, we do it with lifestyle changes, we do it with chiropractic care, and we do it with attitudinal adjustment. Because how you feed yourself, how you take care of yourself is the result of your attitude about that.